measure glucose level in intestinal fluid and blood in real time. Secondly, miniature implant automatic data transmission, early detection, and reduce finger pricking, which is minimizing the need for manual blood glucose tests. And secondly, cause of functional loss. Why the function loss is based on biofilling, accumulation of protein and cells on the sensor surface reduce sensitivity. Any inflammatory response, sensor drift, loss of calibration over time leads to incorrectly reading. Battery or molecule degradations, power sensor material may wear out over a few weeks. Glucose transport delivery. Thirdly, improved efficiency can improve by surface coating, smart algorithm, extended lifespan, sensor integration with insulin pumps, miniature and biocompatibility. Lastly, patient-centered care impact, better diabetes management, more stable glucose control leads to fewer complications, improved lifestyle, freedom from constant finger pricking and manual recording, real-time alert, one patient and caregiver of dangerous glucose level, personalized feedback, that helps tailor diet, exercise, and medication plans, psychological relief, reduce stress and anxiety around the sugar control. Thank you.
Hi guys, firstly the problem case study is that the functional loss of implantable glucose biosensor. Well, what is glucose biosensor? It is used to monitor the blood sugar level in a real time, especially important for the people with diabetes, and also enables the abnormal fluctuation as a glucose fluctuation such as hypoglycemia. Okay. However, the issue arises is after a certain period of implantation, what is also due to the body's biological reaction, especially the sensor experience performance degradation over the immune system. However, the issue arises is after a certain period of implantation, which is also due to the body's biological reaction, specifically the sensor experienced performance degradation over the time. The immune system reacted likely, causing a fibrous tissue encapsulation and biofilling and inflammatory responses, which are typically cause for the decline in the sensor accuracy and effectiveness. So loss of the function in implantable glucose biosensor is largely attributed to biofilling and fibrous tissue encapsulation, immune response and sensor deterioration. Once it's implanted, the sensor is perceived by the body as a foreign object, which provokes an immune reaction with the fibrotic capsule as a result. This prevents the glucose from reaching the sensor. The protein absorption and cell inherences and the accumulation of waste products during the metabolism also contribute to signal drift and the loss of sensitivity, and compromise the accuracy and performances of the sensor. Some approaches to overcome the functional loss of glucose biosensor is a form of steel surface that inhibits protein absorption and cellular enhancement, reduces frequency of fibrotic tissue encapsulation and inflammation. Examples include dexamethasone or citric acid releasing agent, micro nanostructure of the sensor surface, enhances surface area and promotes glucose contact, assists in keeping sensor sensitivity and improves biocompatibility. Thank you.
Featuring an implantable sensor that measures glucose levels continuously for up to 6 months, a removable and rechargeable smart transmitter with unique on-body vibration alerts, and a mobile application for long-term and continuous monitoring. The sensor is inserted under the skin in the upper arm by a trained healthcare provider in a brief in-office procedure. Innovative design stabilizes the glucose indicator within the hydrogel to maintain accurate readings over months. A gentle-on-skin, silicone-based, fresh daily adhesive patch secures the Eversense E3 smart transmitter to the skin over the sensor. The smart transmitter powers the sensor beneath the skin. The smart transmitter communicates with the sensor via the NFC antenna. Porous matrix of the sensor's hydrogel allows glucose in the body's interstitial fluid to access the glucose indicator, a modified 404. Glucose molecules in the interstitial fluid reversibly bind to the fluorescent indicator molecules in the hydrogel. The indicator molecules are stimulated by the sensor's LED and fluoresce. The intensity of the fluorescent light signal rises and falls in proportion to the body's glucose levels. Special electronics inside the sensor digitize the light signal and send the data to the transmitter every 5 minutes. The body-worn smart transmitter receives this data and calculates the glucose concentration. In case of predicted or current hypo or hyperglycemic events, the smart transmitter quickly provides unique on-body vital alerts to warn users.
Surface modification with biocompatibility coating. Applying hydrogel or PEG coating help reduce immune reaction and prevents fibrous tissue from forming around the sensor, allowing better glucose access. And incorporation of anti-inflammatory and anti-biofouling agents, adding an anti-inflammatory drugs and anti-biofouling compounds, minimizing the inflammation and prevent protein and cell buildup, which helps maintain the accurate readings. And finally, enzyme stabilization techniques. Using protective matrices or nanomaterials to stabilize enzymes extends their activity and improve the long-term accuracy and reliability of the sensor.
For the third question, the question asks about the biological evaluation test for glucose biosensor. So the first test will be cytotoxicity. So what it tests? It tests whether the sensor material kill or harm living cell. So why is it important to test the glucose biosensor in cytotoxicity? It is to ensure no toxic chemical leak from the sensor into skin or blood. So how to do that? We will do lab tests on human cells such as fibroblasts. So next test is sensitization. So it tests whether the sensor causes allergic reaction. So this is important to check whether the adhesive or polymer triggers skin allergy. So the method will be patch test on animal or human volunteer. So the third test is irritation. So we test whether the sensor irritates skin or tissue. So for the glucose biosensor, we will ensure no inflammation at needle insertion site. So how to test is we apply sensor parameter to skin, animal or human, and monitor reaction. So the fourth one is acute systemic toxicity test. So what it tests? It tests the short-term poisoning risk, hour to days. So in glucose biosensor, we will confirm whether there is no toxic chemical enter bloodstream quickly. So we will inject extract into mice and then monitor for illness. Next one is subacute toxicity. So subacute toxicity will test whether there will be harm from repeated exposure. We will do duration from 2 until 4 weeks. So why for glucose biosensor? For CGM1, for 7 until 14 days. So how to do that? We will implant the sensor material in animal for 14 to 28 days. Next is subchronic or chronic toxicity. So what it tests the long-term damage, month to years. So we need to test the glucose biosensor because it is the implantable sensor. Next is genotoxicity. So what it tests the DNA damage with the cancer or mutation risk in order to ensure no material mutate the cell. So we will do MS test bacteria or mammalian cell assay. The last one, the number 8 is hemocompatibility. So what it tests the blood safety, whether it will cause clotting, cell damage. So why? It's critical for needle-based or implantable sensor in blood. So how to do that? We will do tests in hemolysis and thrombosis.
Okay, so for this biological evaluation test for glucose biosensor, so first implantation from ISO 10993 6. So what it says, how body reacts to implanted materials, for example scarring and infection. Why is it for glucose biosensor? It evaluates tissue response to needle or sensor under the skin. So the method is implant in animals, check for fibrosis or inflammation. Next, the reproductive or developmental toxicity. It is from ISO 10993-11. So what it does? Harm to fertility, fetuses or babies. Why is it for glucose biosensor? It is rarely needed unless sensor hormones or chemicals affect reproduction. The method is from animal studies by pregnant rats. So next, the degradation from ISO 10993, 9 and 13. So what it does is how materials break down in the body. For example, polymer coatings. Why is it for glucose biosensor? It is needed for biodegradable sensors. For example, dissolving microneedles. Or the method is it stimulates body fluids and analyzes breakdown products. So next, carcinogenicity from ISO 10993 also. So what it says is cancer risk after years of exposure. Why is it for glucose biosensor? It is only for permanent implants. It is up to 5 years. So the method is 2-year rodent studies. It is expensive and rarely required.
So for the next part, I will explain about the main component of the implantable blood glucose sensor. Basically, there are 5 main components of this biosensor. So for the first one is sensing element, which is glucose sensor. So the electrochemical sensor usually type of glucose oxidase base sensor, and for the materials that used for this component usually is carbon nanotubes, graphene or conductive polymers. So this material must be undergo biological testing of cytotoxicity, sensitization and irritation according to ISO 10995 and ISO 1099310. And then for the next component is biocompatible housing. So the material selection for this component must be non-toxic, non-immunogenic and non-carcinogenic. So the material usually used is titanium, platinum, and also ether ketone. And then for the coating, it is usually coated with hydrophilic or anti-biofouling coatings. So the biological testing that must be done to this component is sensitization according to ISO 109310 and irritation based on ISO 109310. And then for the next component part is power source. So there are two type of power source. The first one is wireless power source and then battery. So for the wireless power source type, it usually use the concept of inductive coupling. So for this type of power source must be undergo biological testing of cytotoxicity based on ISO 10995, which is specialized for inductive coil. And then for the battery, usually we use lithium or solid state batteries. So the biological testing that must be done to this type of power source is toxicity testing based on ISO 10935. And then for the next component is data transmission module. So it usually use wireless communication such as Bluetooth or NFC. This type of data transmission module must be not interfere with biological tissues. So this type of data transmission module must undergo biological testing of electromagnetic safe based on ISO 10931. And then for the last component of implantable blood glucose sensor is controller or processor. So this component must be undergo biological testing of cytotoxicity according to ISO 109935.
Okay, so next I would like to take part on explaining about the implantable blood glucose sensor by the property category. For the first category is chemical properties. The design consideration is biocompatibility testing. So materials should undergo tests for cytotoxicity, sensitization, irritation, acute systemic toxicity, and subchronic toxicity. It is based on the ISO standards ISO 109935. Next is the new non-toxic enzyme. Enzymes like glucose oxidase must be non-toxic, stable, and non-immunogenic, and should be tested for immune response. It is based on ISO standard ISO 109936. So for the next category is morphological properties. The next consideration is design considerations. First, surface integrity. Sensor surface should be smooth, non-irritating with controlled roughness to prevent protein accumulation, and biofilm formation. Coatings must pass the leachability test. It is from the ISO standards ISO 109312. So next, the long-term stability. Materials must be tested for degradation and biocorrosion over extended periods in contact with blood and tissues. It is based on the ISO standards, the same ISO standards 109912. So next category is mechanical properties. The design consideration is by strength and flexibility. Materials should have sufficient strength to avoid breakage and deformation while being flexible to accommodate tissue movements. And next, the fatigue resistance. The device must be tested for fatigue and cyclic loading to maintain integrity over time. Both of them is based on the same ISO standards from ISO 109912.